Okay, so this is just going to be a really quick update on the doctor's appointment that I had today. Today is the 29th of January. For today's appointment, it was a growth ultrasound and a checkup. During the ultrasound, everything looked good, is what the tech told me. Her heartbeat was 157 today. Her amniotic fluid was good. Her placenta was good. They told me that she has turned and she's like lower down in me now, and she's basically in the position, and they don't think that she'll turn anymore because she's pretty much out of room to move. She measured in at 3 pounds and 11 ounces, and she's in the 63rd percentile, which is a little bit above average, so they're not really overly concerned about her growth now, but they're going to continue to do the growth ultrasounds. I've got another one in 2 weeks to make sure that she is developing and that there are no problems. During the ultrasound, the only thing that the tech had really said anything about was that I lost my train of thought. The positioning of the baby and stuff. And she had told me that, and I don't know like how accurate that is, her saying that, but she said, that if she were me, she'd be like ready just in case she winds up coming early. But I did get a few pictures. I got, I think, 4. And the first one, I'll try to show you guys like this. Eek! It's basically her girl parts. Like, every ultrasound I go to now, they're always like, oh, do you know what it is yet? It's like, yeah. And they're like, well, we can double check for you. So I've always said, okay, sure. And they apparently love printing off pictures and giving them to me with like her little lady bits and writing I'm a girl or girl and pointing little arrows to it. The rest of them are all like profile shots of her face because she's so big that they can't really get her in a whole thing anymore. But there's one. And they're all pretty much the same. They weren't like taken at the same time, but they look pretty much the same. She didn't really move much during the ultrasound. More than anything, like, she moved her face around and opened and closed her mouth, and it kind of at points it looked like she was almost like chewing on something in there, which I don't think that that's possible. But with my stuff, my blood pressure was good. I've lost 1 pound, and my doctor wasn't really concerned because it's just a pound. That's not a big deal. So now I'm back down to 197. I talked to my doctor about pain control methods during labor and delivery because I have kind of decided that I don't want an epidural. I am not saying that I want natural childbirth. I don't want that. I want drugs, most definitely. I'm not that brave, but I want to avoid an epidural if possible. I'm thinking right now that my plan is when I go into labor and stuff, and once I get there and I'm admitted in the hospital, I want to try to use Demerol. I'm open to the epidural if the Demerol does not help enough, or if I feel like I can't take the pain, I will have an epidural, but I would like to avoid one at all cost. Just for the simple fact of I hate catheters. I've had bad experiences with those before when I was younger and had to be hospitalized as a kid. I don't like the idea of having to be stuck in my bed, which they've already told me that's their policy. And I've heard like the hospital where I plan to deliver, I've just had a lot of people tell me that, their epidurals didn't work there, or it wore off, or, they weren't good about this or that about it, so I'm just gonna, I think, myself personally, try to avoid the epidural and go for Demerol instead, in which my doctor was okay with that. She told me, if that's what I wanted to do, that's fine, to just keep an open mind, because things might not go exactly as I plan. So I guess in the end, I'm going to make a birthing plan, and it's going to be kind of just a loose brainstorming, rough draft type idea of, I have hiccups now, sorry, of like what I'd like to happen with it. So there's that. We talked about like the allergic reactions I've been having to just skincare products lately since I got pregnant. I'm allergic to deodorant now. I've had some issues with my soap and with my lotion, and these are products that I've been using, like, way before I got pregnant. Like, I've used the same brand of deodorant since I was in middle school, and now I'm allergic to it, and I can't use it anymore. And in all honesty, it's not really a comforting thing when your doctor looks like at a patch of your skin where you've had a reaction, and they tell you, I've never seen anything like this before. So, showing that it's definitely not some type of like bacterial or fungal infection. It's definitely an allergic reaction. It's just really severe for whatever reason. It's just, I guess, kind of a combination of how my body is reacting to the pregnancy, and the fact that I do have really sensitive skin and issues with products, before being pregnant. So there's that. And otherwise, everything, like I said, it went really well, and they're not concerned about her. The only thing they're concerned about, honestly, is just keeping up with the growth ultrasounds and making sure. So in 2 weeks, I go back for a regular checkup and an ultrasound, and at that point, I'll be 32 weeks, I think. 32 weeks, gosh. And then 2 weeks after that, I will go back for an ultrasound and a checkup, and they'll send me over to the hospital to do one of those NSTs, and I think she said after that I'll be going back weekly up until I deliver. So we're getting pretty close now, but that's it for the doctor's appointment today, and I'm gonna turn off my computer now and go to sleep because it's like almost midnight.